We are on to week number 5 post medial patellar luxation surgery with Hank. This clip is actually the end of week 4. This is very typical of our walks. He would lie down and not move any further and want me to pick him up and carry him home. However, we only went a maximum of 2 blocks, so I knew he was just fine to walk himself home. You'll notice he doesn't have a leash on. He walks better without a leash. He was trained to walk without a leash prior to surgery, and so to get him to walk after surgery, I tried taking his leash off, and sure enough, here we're into week 5 and he's walking great off leash. His back is nice and straight. He used to have a C-shaped curve in it on his lumbar spine, and that is pretty much gone away. We've done a lot of massage therapy with him to release some muscles to get his back to straighten out, and I think that's really helped. He has a slight little medial rotation still in his left leg, but nothing, I don't think it's anything to be too concerned about. I think it's getting better each week. He also is starting to lift his leg to go potty, which he did before surgery, so that's good. I think that's a plus, and I have a short little clip of it. It's kind of weird showing you a clip of my dog going potty, but it's showing you that he can balance on his left leg, the leg he had surgery on. And here he's just picking up the pace a little bit, which is a nice fast walk for me, and that makes me happy that he's able to do that now. And we're still continuing the same exercises in the previous weeks. So maybe just challenging him by lengthening the time. So here he's on his stair stand, and we do it for about a minute, and he's doing great. I kind of walk around with the treat, make him move his head in different directions so he has to shift the weight in his back legs. And then we add a couple new exercises in as well. So you'll see here he is learning the figure 8. And I just put 2 shoes down kind of close together. And he follows my hand, which there's a treat in it, a very yummy treat. And he follows me into a figure 8 pattern. And this is just kind of to get his brain to talk to his leg to make a quick change, a quick turn. And so I think he's doing great here. And we change directions so that he can have a chance to change that movement up so he doesn't get too used to going the same direction each time. And then, every once in a while I'll just have him do a couple sit to stands. I think those are really important. And we've been really working on getting him to stand without walking forward. Here we're doing a shake, and he knew how to shake prior to the surgery, so I thought I would add that back in just because if he lifts up one of his front paws, it will make him balance on his back legs a little differently. So he puts all the weight in his front paws, so I figured if we picked one up, that would make him transfer his weight to his back legs a little differently. And we also wipe his paws after a walk now. Before I'd actually pick him up and hold him and wipe his paws, but now that he's shaking, I figured, he's got that balance and he's got that strength and support to lift one paw up. So we actually wipe his paws standing, which is progress. I like that. And again, we're just going to do those sit to stands every once in a while. I fit those in as often as I can throughout the day. And I found that if I sit down at his level right in front of him, when he stands, he will keep the weight on his back legs without moving forward. If I'm standing upright, he's got a lot of room to move, and sometimes he will stand and then walk around me. So I kind of get right in his face, right in front of him, and just sit down at his level so that when he stands up, he stands from his back legs. It's kind of like a little squat. It's working his muscles to stand and sit. And we are trying this out. I found it's a squishy, almost like a seat cushion that you pull up with air. And I found it in our closet, and I thought, well, maybe we should try to balance on something like this. So I put his 2 front paws on first because that's where he's most supported and strong, just so he can kind of see what it is and that he has to balance on it with his 2 front paws. And then I found a board that I set on top of it. So as you can see here, this is the very first time we're trying this out on camera. He's a little shaky, a little nervous about what's underneath him. And his smaller muscles, as you can see, are starting to turn on. That's what that shaking is all about. His legs are a little close together. He's kind of tucking into a fetal position, I think, out of just being a little nervous about what he's standing on. So, and that makes it a lot harder to balance when all 4 legs are really close into one spot. So I'm just stretching his legs apart as best I can, supporting him and finding his alignment. Here's just a different angle of the camera. You can see how he wants to shift everything to the right leg. And so he's still he's still working here to balance, but I'm just going to help him out as best I can, just positioning his legs without without making him too uncomfortable. He tends to bow his front two legs out, so his front legs at his elbows kind of bend outward, and so I pull them back underneath him. And then his back two legs, his knees turn inward, so I try to pull those, externally rotate those back legs back to parallel. I know it sounds kind of goofy, but I just try to make all four legs parallel. So all toes are staring straight ahead, his knees are staring straight ahead, his elbows aren't bending out to the sides, they're, pointing straight back. And he's doing great. And, I'm going to stay near him so that if he feels like he needs to jump off or if he slips off, I can catch him. But he's doing wonderful. And just this little bit of wobble from side to side is really waking up his smaller stabilizer muscles throughout his entire body, even his core. So I think this is good to do. Changed it up in this video. This is a different day. He was doing so well with that blue squishy. I changed it up and put a rolled up yoga mat underneath that same board. So now it's kind of like a teeter-totter. He's got to rock forward and back to find his balance. And of course, this is the first time we're on here, so he's going to put all the weight in his front legs, his stronger supportive legs. And I'm just going to reposition him to try to get him to transfer that weight back. As you can see, I'm pulling his elbows back in because the elbows kind of want to bend and turn out. His head veers to the right a lot, and his right leg is his stable leg, his strong leg. And when his head veers to the right, he actually gets that C-shaped curve back in his low back. So when I push his head back to center, his hips magically just straighten out. So his spine just kind of follows his head all the way back. So if you're noticing, if you're doing something similar like this to your dog, just readjust their head and just notice how the spine just follows all the way down to the tail, just a nice alignment. And I'm just pushing a little bit on this board just to get him to find center and to see if he can actually balance that center without it falling forward. And this is his first time on here, so I don't expect him to be perfect by all means, but we're just kind of playing around with it. He's doing great. His tail's tucked. He's not really loving it, but obviously he's not jumping off or doing anything crazy, so he can handle it. And again, just pushing his head forward, straightening out his spine. With this camera angle, you're not able to see that C-shaped curve, but whenever his head turns to the right, he curls his back again. So just, and here he's doing his own wobbling, which I really like. And I just am supporting him with my hands around him just in case he loses his balance. But he's doing great. And he's just getting used to this teeter-totter. That's what it's all about, just getting used to all this new equipment that we're piecing together from our basement. And here I'm just sliding him off carefully so that he knows that he can walk off the front no problem, just to show him that when he's done, he can go when he wants to. And so we're doing the same thing with that yoga mat rolled up, but instead of being like a teeter-totter rocking forward to back, I put the yoga mat so that he rocks side to side, right to left. It's a little bit more tricky for him because obviously he doesn't want to rock to his left because his left leg is the leg that's unbalanced and atrophied. So pulling his elbows back in, as you can see, and trying to get him to look straight ahead. He's rounding his low back again, but we'll get him there. And he rocks to the right, but we'll move him back to the left so that he knows that he can transfer that weight to the left side and he'll be just fine. There he does that head twist again. So in the beginning, I think it was like week 3, we were doing those weight transfers, and I'm still doing the weight transfers when he's just standing on the floor, but now that we're up here, I'm thinking I'm going to be doing those weight transfers on this little contraption because it's a lot easier for me to transfer his weight to his left side. It's easier for me, harder for him, but I think it's going to work great. So Hank has been doing really good in week 5. His therapy exercises are amazing. We're adding a slight elevated hill to his leash walks. He's getting his energy. He wants to go up those stairs so bad. He wants to go on our bed so bad in furniture. We're not letting him. We have kept the cone on him. It's week number 5 because that tiny little spot just does not want to heal. And look what happened today. He went back after it. I took the cone off. We, went for a quick walk. We pottied and I didn't put the cone back on immediately after we got inside, and he just went right for that scab and it picked right off again. It wasn't obviously deep enough to stay on. So we kind of took a step backwards with that silly little spot on his knee, and you can see that metal piece shining through, which we think is a pin. So um, we will just wait until we get an x-ray, which isn't until week 8 or week 9. So I will keep you guys posted on that. But otherwise, he is doing fantastic. And we will see you soon in the weeks to come. Thanks so much.